Hey y'all, welcome back to Healing and Dealing. On this show, we look for non-pharmacological ways to improve our brain and mental health in a world that seems to be working against it. Should I say seems? I feel like that. There's no seems about it. The world is most definitely working against us, isn't it?
Yes.
Well, we'll get into that later.
Your diagnosis is not your destiny, as Dr. Amen, the popular author and television psychiatrist says, you're not stuck with the brain you have. You can change it.
But how? Both mental illness and normalcy are judgment calls. And if you can't know where to finish, at least you got to know where to start, right, Justin?
Yes.
Where do you start?
And if you can't, the only place to start is where you are right now. To know thyself, to know thine own diagnoses, options and rights. Because if we are to advocate for our own
best care,
we need to understand, overstand, and understand our bodies, minds, and our health care plan. We need to learn to be good patients.
In HD 13, we encouraged you to start a health book of your own by collecting your medical and dental records, family history, allergies, medications including over-the-counters and supplements, names and phone numbers of all your doctors, all your providers, emergency contacts, and other stuff like your food chart, your luteal phase, and your mood charts. Remember,
you are the captain of your medical team. That team may include a primary care provider, specialist, pharmacist,
mental health providers,
laboratories and hospitals, insurance agents and social workers, physical therapist, nurse, physician assistant, caregiver, and you as the patient.
Captains need their playbooks. You need a health book.
Yes, you need a health book.
So Santa Goldberg, RN, wrote this book, How to Be a Patient. She suggests also keeping specifics about any equipment that you're using, like if you have a CPAP machine, what about the make and model of that? If you forget a part and you have a hospital stay, information like that can help get you things that you need. Also monitors, braces, and also she has some tips for insurance and billing. She suggests setting aside one evening a month to review your insurance claims and status. I'll read from the book here. Set aside one evening a month to review your insurance claims and status. Collect any explanation of benefits, EOB forms, bills from therapist offices or hospitals, and statements about eligibility and open enrollment. Put them in a pile on a table in front of you or collect them digitally on your screen. Highlight and note things that are unclear or items for which you need to gather more information from your insurance company. This is a chance to review everything in a low-stress setting rather than opening a claim after a long day of work and trying to ensure there aren't glaring issues. If your bill of health has been complicated as of late, set aside additional time to review upcoming appointments, tests, and procedures. for which you'll eventually be charged. Most months, this will be a pretty low-key task, and you can do this while having a cold beer or watching a favorite show in the background. Or make it an outing and do it at a coffee shop. And don't forget to make time to make those phone calls too.
Increase your health literacy. Find out normal ranges for your condition, whether that's blood sugar or blood pressure. Find out what could happen if you run out of medication. Don't follow through with instructions.
If your provider refuses to listen to you or take your concerns seriously, that's a red flag. But not all doctors are toxic. Make sure you're not miscommunicating. Use every visit to hone your communication skills. Have a plan. Ask questions. You're going to ask some questions that you could ask. What is the diagnosis? What do I need to do about it now?
Why is it important that I do that? Can any medications be cut? What's next?
Yeah, this one. Can any medications be cut? That's a question that you want to ask at every appointment, right? Because you want to reduce the toxic load on your system. Remember to bring your binder to all appointments so that you have a place to record what you've learned.
The word doctor is straight up Latin for teacher. A physician is a person legally qualified to practice medicine, but neither a doctor nor physician can cure a broken leg. He can't set the bones, but the body does the work. He can reset the bones, but the body does the work. The provider helps by his knowledge and aid. It's the same in mental health.
Yeah, mental health we have from this classic. As you progress in therapy, the adventure is yours to know why you did what you did when you did it. To know what caused those dark and unknown fears, which came in nightmares as a child. To know where your moments of pain and pleasure lay. There is much which an individual does not know about himself, about his parents, about his motives. Some of the things you may find may astonish you. But you find them, right? And then you, what's this?
Authority can compel individuals to follow orders even when harmful consequences are present. Grooming and dressing nicely to your visits helps even out the psychological balance.
Yes, we got this from How to Be a Patient in Nurse Goldberg's book. She says, dress up for better care. Without fail, my mother always reminded us to wear our finest undies when we went to the pediatrician. Sometimes she even bought us new ones. I never understood this practice and hadn't thought about it in years until I came across the Forbes article that proposed that patients who dress up receive better health care and are more likely to have their concerns acknowledged. Dressing well is a power move in other professional and life arenas, so it makes sense. From the moment you step into a medical setting, doctors and nurses are appraising you, subtly, often unconsciously, assessing your appearance, hygiene, cognitive state, body language, and the way you move about the world. We are trained to notice. If you dress up, and by this I mean something thoughtful, not black tie, even just a little bit. It gives the impression you're taking things seriously. When you show up for an appointment looking spiffy, it suggests your date involves ritual. It says, even in the most understated way, you value yourself, the exchange, and your health. And ritual is a way of saying task repetition. So, that helps your structural neuroplasticity too. But where were we? Oh, right here. More on this first impression here, right? We picked up this new textbook the other day. And here's what they say. Initial human contact is established or reaffirmed in a very short period of time. Zunin reported that the average length of time during which strangers in a social situation interact before they decide to part or continue their encounter was 4 minutes. Of course, your appointments are longer than 4 minutes. But if your doctor or the nursing staff or the income staff has already made a decision about you and, in their first 4 minutes, that's part of your time. That's part of your time that they've made these false assumptions about you. This length of time was established by careful observation of hundreds of people at parties, offices, schools, homes, and in recreational settings. 4 minutes, which was approximately the minimum breakaway point, was the length of contact that was considered socially acceptable before a shift of conversational partners could occur. Zunin believes that the 4-minute concept applies appropriately to both first impressions and to the ongoing contacts, such as husbands and wives on awakening or at the day's end, children and parents, and anyone you know well and greet often. So that is Leonard Zunin and Natalie Zunin in Contact, Los Angeles Nash Publishing, 1972. Also, being prepared by showing up on time and bringing your health book reduces stress and anxiety caused by white coat syndrome and reduces the likelihood of medical error. Do you know what white coat syndrome is?
It's something that I always forget.
That is when you get nervous, and so your blood pressure rises when you go to an appointment. You can't get a good reading because your blood pressure is always up every time you go to the doctor, because going to the doctor is what makes my blood pressure rise. That's what they call the white coat syndrome. It's a little different from authority. What we were just saying, authority can compel individuals to follow orders, even when there's harmful consequences. Because we make choices that are not in our best interest all the time. This is kind of another way. Some other documents that Sandra Goldberg suggests. She suggests having a legal division in your binder. And in that division, you want to include your patient's rights, the living will, healthcare power of attorney, and physician's orders for life-saving techniques. What are your rights as a patient?
As a patient, you have the right to be informed about your care and options for treatment.
To
be treated considerately and respectfully, with privacy and confidentiality. Seek a second opinion or alternative treatments. Know the cost of your care and options for paying for it. Be advised of conflicts of interest your provider has in respect to your care. Leave your provider and seek treatment elsewhere.
Yes. Now again, you're the captain of your medical team, so choose your team carefully. Especially when you visit with specialists or if you have to have surgery. If you're set for surgery, you can investigate every single person that's going to be in the operating room, from the surgeon to the anesthesiologist, all of them. And do not assume that your various providers have spoken in depth about you or your condition. If you go to see a specialist, ask them to do a full physical. They should know, they need to have everything they need to know.
Your health book can be immensely helpful in emergencies. Even better, not needing
medical care, right?
Yes, practice a good mindset and enjoy even better.
A good diet.
A good diet.
Yes. Keep going. Wear appropriate PPE.
Wear appropriate PPE.
You go reduce your
exposure to toxins and learn basic first aid.
So first aid. The definition of first aid is the immediate care given to a person who has been injured or has been suddenly taken ill. It includes self-help and home care if medical assistance is not available or delayed. It includes well-selected words of encouragement, evidence of willingness to help, and promotion of confidence by demonstration of competence. First aid knowledge and skill often mean the difference between life and death, the difference between temporary and permanent disability, the difference between rapid recovery and long hospitalization. First aid training is of value in preventing and caring for accidental injury or sudden illness, caring for persons caught in a natural disaster or other catastrophe, equipping individuals to deal with the whole situation, the person and the injury, and distinguishing between what to do and what not to do. So lots of good reasons to learn some first aid.
Remember, we're not medical professionals and do not give medical advice. We're just trying to learn all we can about the brain, the way it works, and what we can do to improve our brain, our overall mental health.
Mm-hmm.
We're encouraging you to do the same.
Our challenge to you this week is keep working on and with your health book and to increase your health literacy.
Thank you for joining us on this journey. We wish you the best of health, and we'll catch you on the flip side.